We have confirmed an additional 154 cases over the last 24 hours, bringing the total number of cases in Alberta to 4,850. Since my last update, we have also confirmed 5 additional deaths, meaning that there have now been 80 deaths in our province. These include 2 new deaths at continuing care facilities, 1 in Calgary Zone and 1 in South Zone. I want to offer my heartfelt sympathies to everyone mourning the loss of these individuals. Again, these are reminders that COVID-19 can be deadly and none of us are immune. As of today, there have been 483 cases in continuing care facilities across Alberta, which includes 52 deaths. As of today, there have been 759 cases confirmed among workers at the Cargill meatpacking plant. There have also been 249 cases confirmed among employees and contractors at the JBS plant in Brooks. These outbreaks show the remarkable ability of the virus to spread quickly. That is why we are doing everything possible to identify and manage every outbreak, including those in High River and Brooks. Alberta Health Services has rapid response teams in place and has worked aggressively to ensure operators have implemented outbreak protocols and to make sure that cases are identified and supported so they can be isolated, and ensure that cases get any health care that they need. AHS has made sure that contacts are identified in order to contain spread, and has also made testing widely available, including to those without symptoms in outbreak settings. Alberta Health Services has also been working very hard on providing temporary housing for isolation and any other needed supports for those who are at risk. We are also using these measures in other settings where there may be high risk of spread. This includes any meat processing facility where even 1 case is identified, and adapted versions of these measures in the current shelter outbreaks in Calgary. As the Chief Medical Officer of Health, I want to stress that the modelling forecast shared today is good news. Alberta is starting to see the results of the collective sacrifices we have made, but I want to stress that this fight is far from over. Modelling is just a projection of a potential future. It is not a guarantee, and cases could easily spike in Alberta if we are not careful. I know that many Albertans are tired of the public health restrictions. Many of you are tired of hearing me say we are all in this together. Every single Albertan has been making sacrifices for many weeks, and every Albertan has been impacted by this pandemic. You have been making sacrifices every day to make sure that your loved ones, neighbours, co-workers, and fellow citizens are safe. Today, I am asking you to celebrate the success we have had by holding on just a little while longer. Our public health measures are working, and we need to keep them working. We've actually been having some discussions about the concept of peak, because one of the challenges of the models, and I referenced this in some remarks I made last week, is that the models give a sense that we will go up and come down, and there will be an end to this within several months. And that's just a function of the mathematical equations that are used to build the transmission dynamics within that model. But I think what we're seeing now, the reality is that we have managed to slow spread, and so we are seeing a kind of slow, there has been a rise in the last week or so with respect to new cases, hospitalizations, but in general, overall, since we have had our cases, we haven't seen a sharp increase. And so what I want to make sure people understand is that as we flatten that so-called peak, what we're doing is we're pushing out the duration of how we're spreading this infection out over time. And so hopefully what we do is we keep our cases, our spread at a relatively low rate. Our health system is able to maintain capacity to deal with those who have more severe illness. We're able to keep the virus out of our most vulnerable populations, like those in continuing care facilities. But I think we should not imagine that the end of any kind of a peak or curve will be happening within, say, 2 to 3 months. Because the reality is that this virus will be with us, and it will remain a threat as long as we have no effective treatments or vaccines against it. And so as we look to the future, we need to think about, again, it's maybe less of a peak now and more of a kind of steady state that we maintain at that low rate is likely to be that future. So yes, we've pushed that peak out, but hopefully it won't be actually a peak. Hopefully it will just be that low, steady state where we're able to maintain our ability to manage and keep the transmission rate relatively low.